This is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit today about the timing and use even of resurfacing of the skin after scar revision. I've had a number of patients that have come in after injury. They've had scar repairs or they have had a primary repair in an emergency room and were concerned about the way the scar looked and wanted revision of the scar. And I would say that resurfacing in general becomes an invaluable tool in getting best or optimal results after scar revision. Typically, scar revision, which I've written a fair amount about, and I encourage you to visit my website at maasclinic.com. That's MAAS clinic.com. And I've written a nice treatise that's an excerpt from a book chapter that I did on scars and scar revisions. If you look at the overall recovery phases in wound healing, using a method of resurfacing after we take an old scar out and repair it, in one of the methods that I've described, it's a very good way of blending that old scar with the surrounding skin and making it even less perceptible. Now, typically, linear scars that are across prominent areas of the face, like the cheek, for example, have to be broken up into smaller components using techniques like geometric broken line closure or running W-plasties, where the line is very irregular. It makes it much more difficult for the eye to perceive it. And at some point, usually about 6 weeks after the treatment, 4 to 6 weeks after the treatment, while the wound has still pretty good strength now from the wound healing process, but is still in the very active phase of remodeling, we'll commonly now use fractional laser. You can still use full laser or even sanding, but fractional laser is a very good tool. And I'll go over that area and blend that scar that we've revised using fractional resurfacing in that time frame at 4 to 6 weeks. And we find that the scar actually even further sort of self-levels and melds and blends into the surrounding area more effectively, making the color match more even, and even the texture of the scar itself closer to what the skin looks like in the surrounding regions. There are really key areas. Obviously, there are some areas where we can hide scars and creases, like the fold or around the hairline or ear, where resurfacing isn't necessary. But I find that old or new scars can be improved with resurfacing, fractional laser, and I can really adjust the density, how close together the little dots. When it's a fraction, it's not the entire surface, but only a portion, and I can adjust how close together or how big of a fraction of resurfacing we're doing over a scar to optimize the wound healing and blend it with the surrounding skin. So it's an excellent question about timing. 4 to 6 weeks is an optimal time if I've revised a scar, but if somebody wants just improvement of an existing scar, we can really do blending of that scar at any time with a method of resurfacing that's appropriate for that region. I encourage you to write questions to me at drmaas.com, which is our video blog. You can send pictures, videos. I'm happy to do that, or just write your questions. I'm always happy to answer them, and I'm always looking forward to hearing more from you. That's Dr. Corey Maas on Looking Your Best.